Sir, we are live on Facebook. You can start now. Thank you.
So, Auzu billahi minash shaitanir rajim. Bismillahirrahmanirrahim. Assalamu alaikum. I'm Dr. Abdul Qadir Khan, Chairman, Organizing Committee of this Muhammad Medical College COVID-19 web series. I welcome all of you on behalf of Muhammad Medical College Hospital, Mirpurkhas, and this web series is organized by Muhammad Medical College Hospital, Mirpurkhas, in collaboration with Pak GI Liver Disease Society, Pakistan Medical Association Mirpurkhas, Liaquat University of Medical and Health Sciences Jamshoro, and Pakistan Medical Association Mirpurkhas. Today is the fourth and the last web series of this MMC COVID series. Inshallah, we are hopeful that inshallah in the future we will continue this type of a series in future as well. So today will be the two speakers to join this meeting. First speaker will be Dr. Sayyid Zafar Abbas, who is a consultant gastroenterologist and hepatologist, and he is joining us from UK. And the second speaker is the Dr. Lubna Kamani. He is associate professor at National Hospital, Karachi, and the famous gastroenterologist. And then there will be question answer session. There will be comments by our most senior gastroenterologist, hepatologist, Professor Dr. Jafri. The question answer session, vote of thanks by our Dr. Samsula team, concluding remarks by Managing Trustee Muhammad Medical College Hospital, Mirpurkhas. So, going to start the program by the recitation of Holy Quran, and I'm going back to the mic to the Dr. Samsula team for the recitation of Holy Quran and for moderation.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم قد أفلح من تزكى وذكر اسم ربه فصلى بل تؤثرون الحياة الدنيا والآخرة خير وأبقى إن هذا لفي الصحف الأولى صحف إبراهيم وموسى صدق الله العظيم. Assalamu alaikum and welcome everyone on this series of programs on COVID-19, its current and future implications, and the related medical related problems with this COVID. And this is the last of the program or the session. We have already conducted three programs on these topics. Today we have our first speaker, Professor Dr. Sayyid Zafar Abbas. He is consultant gastroenterologist at Northumbria Healthcare NHS Trust UK. He is also a visiting professor at Muhammad Medical College Mirpurkhas as well. So I request him to please give his presentation on COVID-19 and the irritable or the irritable bowel syndrome. So Dr. Sayyid Zafar Abbas, please.
Yeah, thank you very much. Assalamu alaikum. This is my honor and great pleasure to join you all. And a special thanks to the organizing committee, Dr. Abdul Qadir Khan, for inviting me to do this. And I can see that Professor Wasim Jafri Saab is there as well. So, Assalamu alaikum. Kaise hain Wasim bhai? Khairiat se hain? And Dr. Aziz is there. Assalamu alaikum there as well. So, the talk that has been given to me, and so for the next 20-25 minutes, I'm going to talk about functional bowel disease or irritable bowel syndrome in the context of COVID-19 and the management challenges of IBS during the pandemic. I'm trying to advance the slide. Yeah, this is where I currently work. So this is just the introductory slides about the COVID-19, SARS-CoV-2. So as we all know, initially it was recognized at Wuhan in December 2019, although they think that the first case was actually there in November. The main source of transmission is still thought to be droplets, although airborne keeps coming into the equation now and again. Expressions through ACE2, NTM, TRSS2 co-expression is important to get the virus into the human cell. And the virus does contain 25 proteins, which are the identified very quickly by Chinese and passed on to the rest of the world, and which is the target for the therapy and vaccine. GI symptoms are quite common actually in COVID-19. Up to 1 out of 4 people will have some symptoms like diarrhea, nausea, and vomiting. One study identified that under 1/3 of all patients with GI symptoms, तशवीश की बात यह है कि उनको रेस्पिरेटरी सिम्टम नहीं होते, और ज़्यादा तशवीश की बात यह है कि ये वो ग्रुप है जिनमें ज़्यादातर फैमिली को होने के चांसेस और सिवियर डिजीज होने के चांसेस होते हैं. Fecal shedding of the virus has been shown by several studies. AS2 और TMPRSS2 के जो एक्सप्रेशन है वो गट में होती हैं. अनआंसर्ड क्वेश्चंस हैं कि पैथोफिजियोलॉजी क्या है जीआई सिम्टम्स की, और क्या फीको-ओरल ट्रांसमिशन रूट या कोई और रूट होता है. ट्रांसमिशन रूट की बात होती रहती है कि कहाँ से आता है और कैसे जाता है, और ये वायरस इंसानों में आया कैसे. आज जो हम जिन 2 चीज़ों पर दो क्वेश्चंस पर जो कंसंट्रेट करेंगे आज इस टॉक में, उनमें से पहला है कि क्या IBS के जो पेशेंट्स हैं उनको कोविड-19 होने के चांसेस ज़्यादा हैं, और दूसरा सवाल ये है कि जो IBS के पेशेंट हैं जिनको कोविड-19 हो जाए तो क्या उनकी आउटकम ज़्यादा सीरियस या कम सीरियस होती है, डिफरेंट होती है बाकी दूसरों से. जाहिर है कि जब तक कि इस दवा का इस बीमारी की दवा या इसकी वैक्सीन नहीं आ जाए उस वक्त तक ये सारे सवाल चलते रहेंगे. और कोविड-19 से मुतालिक हम अपने आँखों के सामने बदकिस्मतियाँ बहुत सी हैं, लेकिन खुशकिस्मती की एज ए मेडिकल प्रोफेशनल बात यह है कि हम एक नया चैप्टर इन मेडिसिन इवॉल्व होते हुए देख रहे हैं, लिखते हुए देख रहे हैं. बहुत सारे सवालात हैं इससे मुतालिक, बहुत सारी चीज़ें हैं जो सामने आ रही हैं. इन्वेस्टिगेशंस के बारे में डॉक्टर अब्दुल कादिर खान ने और डॉक्टर नीमन साहब ने हैदराबाद से रिसेंटली बात की थी. बहुत सी दवाएं, इस सवालात आते रहे कि पैरासिटामोल, एनसेड्स और दीगर दवाएं इनको देना मुनासिब है, नहीं मुनासिब है. मोड ऑफ ट्रांसमिशन की बात होती रही. पर्सनल प्रोटेक्शन इक्विपमेंट के बारे में बहुत सारे कंट्रोवर्सीज आती रहीं. कौन से ग्रुप्स वल्नरेबल हैं, कौन से नहीं हैं, प्रिकॉशंस क्या क्या होनी चाहिए और होनी भी चाहिए कि नहीं होनी चाहिए. अनएक्सप्लेन्ड या ऑड फीचर्स इस डिजीज़ के आते रहते हैं. हैप्पी हाइपोक्सिया का आता रहा. इसी तरह हाई CRP वायरल डिजीज़ होने के बावजूद आती रही. थ्रोम्बोएम्बोलिज्म इसमें काफ़ी होती है, और क्यों होती है और डिफरेंट कैसे है बाकी दूसरी डिजीज़ से. ट्रीटमेंट नॉन मेडिसिनल कौन सी हैं और मेडिसिनल कौन सी हैं और मुसलसल आती जा रही हैं, इसके बारे में भी कुछ बातें देखते रहे. री इन्फेक्शन अभी तक एक इम्पॉर्टेंट क्वेश्चन है, अगरचे अभी तक इसके बारे में कोई ऐसे खास शवायद नहीं है, लेकिन बहरहाल सम पीपल आर वरीड अबाउट द पॉसिबिलिटी ऑफ री इन्फेक्शन. वैक्सीनेशन आजकल सबसे ज़्यादा जोरदार गालिबन जिस चीज़ पे दिया जा रहा है इसको टेक्स्ट में वो वैक्सीनेशन ही है. लॉन्ग टर्म इफेक्ट्स इसके होंगे या नहीं होंगे, फिजिकल, मेंटल, फाइनेंशियल, और क्या होंगे, किस हद तक होंगे, ये सारी बातें होती जा रही हैं. ऑब्वियसली प्रिवेंशन इज़ बेटर देन क्योर, और प्रिवेंशन के लिए बहुत सारी चीज़ें हैं जिनमें से एक ज़ाहिर है कि हैंड वॉशिंग है. फेस मास्क के बारे में बातें होती रहती हैं और कि कितना प्रोटेक्शन से होती है और कितनी नहीं होती है. इम्पॉर्टेंट चीज़ ये है कि इसको जिस तरह बताया जाता है, जो तरीका उसी तरह यूज़ करें. सोशल डिस्टेंसिंग इज़ वन ऑफ द वेरी इंपॉर्टेंट थिंग्स ऑफ कोर्स. एक और इम्पॉर्टेंट चीज़ ये है कि डिसइंफॉर्मेशन और नेगेटिव इस वक्त जो प्रोपेगेंडा चल रहा है वो बीमारी से कम ज़्यादा नुकसानदेह नहीं है. मसलन ये कि कोई कोरोना वायरस नाम की कोई चीज़ नहीं होती, या होती है तो ये तो एक साजिश है और एक केमिकल वेपन है, और ये तो डॉक्टरों और फार्मास्यूटिकल इंडस्ट्रीज़ के फ़ायदे के लिए बनाई हुई एक ढकोसला है. आप हार्ट अटैक से चले जाएं, कोरोना डाल के आपको अंदर डाल दिया जाता है. इसी तरह अगर आप दाखिल हो गए तो जहर का टीका व्हाटएवर दैट मीन्स लगा के अस्पतालों में लोगों को मार दिया जाता है और डेड बॉडीज़ को अमेरिका को भेज दिया जाता है. सुना कि $10,000 के भी $10,000 की डेड बॉडी बेची जा रही है. एंटी इस्लाम है, एंटी पाकिस्तानी इशू है, और जो मान भी लेते हैं कि कोरोना है तो भैया क्या मौत से डरते हो क्या, किस किस्म के मुसलमान हो, और कोई ज़रूरत नहीं है किसी एहतियात की, और किसी को हर किसी को एक दिन मरना ही है वगैरह वगैरह. ये मसला नहीं है कि बीमारी है या नहीं है, ये मसला और ज़्यादा बन जाता है जब हमें इसकी भी फिक्र नहीं रह जाए कि कोई प्रॉब्लम यानी وجہ سے پرابلم سے زیادہ اس سے متعلق دوسرے ایشوز انفارچونیٹلی ہم ان سے لڑنے میں مصروف ہیں. ایک اطمینان کی بات بہرحال جیسے یو کے میں ہے وہ یہ کہ اب آر جو ڈاکٹر عظیم نے اس دن بڑے اچھی طرح سمجھایا تھا کہ آر چیز کیا ہوتی ہے نمبر وہ کافی کم ہوتا جا رہا ہے اور پاکستان میں بھی سنا کہ ماشاءاللہ کافی کم ہوتا جا رہا ہے جس کا نتیجہ یہ ہے کہ نارملائزیشن کی طرف ہم جا رہے ہیں اور اسکول وغیرہ دوبارہ کھلنے کی بھی چیزیں ہو رہی ہیں. بہت تیزی کے ساتھ اس سال بہت ساری چیزیں آتی رہی ہیں اور آتی جائیں گی. ڈاکٹروں نے پیرامیڈیکل سٹاف نے نرسوں نے ہیلتھ کیئر ورکرز نے بیسیکلی اس ڈیزیز پہ اور اس معاملے میں بہت ساری قربانیاں دی ہیں ابھی تک چل رہی ہیں. اور جس طرح کبھی ہمارا نام کسی وجہ سے خراب بھی ہوا تھا تو وہ ہم دیکھ رہے ہیں کہ بہت تیزی کے ساتھ بہت اچھی طریقے سے دنیا بھر میں اس پروفیشن نے پرفارم کیا ہے. گیسٹرونٹولوجی اور کووڈ کے بارے میں جو چیزیں ٹاپکس آج کل زیادہ ایشوز چل رہے ہیں اور ڈسکس کیے جا رہے ہیں جن میں ایک ہے اپر جی آئی اور جیسے کہ ڈاکٹر میمون صاحب نے حیدرآباد سے ریسنٹلی ٹچ بھی کیا تھا اس پہ کہ پی پی آئی جن لوگوں کو یعنی پروٹون پمپ انہیبیٹر جو لوگ لے رہے ہیں ان کو کووڈ-19 ہونے کے چانسز زیادہ ہیں. لیور ڈیزیز سے ریلیٹڈ کیا ایشوز ہیں. پینکریاٹک ڈیزیز سے ندیم تہانی نے یو کے سے ڈسکس کیا تھا انفارچونیٹلی وہ میں نہیں اٹینڈ کر پایا. اسمال باؤل اور لارج باؤل جیسے کہ انفلیمیٹری باؤل ڈیزیز جو ابھی تھوڑی دیر بعد لکھنا ان شاء اللہ ہم کو ایجوکیٹ کریں گے اس کے بارے میں. اور پیورلی گیسٹرونٹولوجسٹ کے کام کی چیز کے اینڈوسکوپی جو لوگ کرتے ہیں اینڈوسکوپسٹ جو ہیں ان کے لیے امپورٹنٹ باتیں کیا ہیں خصوصاً وہی جیسے کہ پی پی ای جو ہے وہ ایک آ جاتی ہے اور پی پی ای سے متعلق بہت سارے ایشوز آتے رہے اور جاتے رہے. Coming back to IBS, IBS is a type of a functional bowel disorder, which is in turn type of functional GI disorders. Functional GI disorders کے 6 ڈومینز ہیں جن میں سے ایک فنکشنل باؤل ڈسارڈر جس کے ٹائپ irritable bowel syndrome. اس کی ڈیفینیشن میں بہت زیادہ امپورٹنٹ ہے کہ ریکرنٹ abdominal pain ہو جس which can be associated or is associated with defecation or change in the bowel habits. So diarrhea predominant, constipation predominant, mixed یا untypable IBS. پھر بند سے انکار کیا لیکن بہرحال کچھ اور بھی وجوہات ہیں جو انسان کو ٹوائلٹ میں زیادہ ٹائم گزارنے پہ مجبور کرتی ہیں. آئی بی ایس کے بارے میں بہت تیزی سے بہت ساری باتیں آپ کو پتہ ہیں لیکن جو تیزی سے کچھ امپورٹنٹ باتیں کرتے ہوئے چلیں. Prevalence 11% worldwide, female predominance, young age onset of symptoms is quite common. Symptoms come and go and they overlap with other functional disorders. Quality of life کا بڑا ہو جاتا ہے اور بہت زیادہ ایکسپینسو لوگوں کے ہو جاتا ہے. اور ہماری لمیٹیشنس میڈیکل سائنس کی بھی اور سوسائٹی کی بھی ایسی ہیں جس میں ہم فنکشنل ڈسارڈرز انکلوڈنگ آئی پی ایس کی مینجمنٹ کرنے میں کافی چیلنجز کا سامنا کرنا پڑتا ہے. جن میں سے ایک یہ ہے کہ فزیشنز جو ہیں ایز فزیشنز وی آر انفارچونیٹلی ٹرین ٹو سیک پیتھولوجی. مجھے معلوم ہے محمد میڈیکل کالج خاص طور پہ اور دوسرے بھی ادارے پاکستان میں کوشش کر رہے ہیں کہ کسی طرح فنکشنل بلڈ ڈسارڈرز کی ٹیچنگ اور ٹریننگ بہتر کی جائے. ابھی تک ڈسمسو اور نیگیٹو ایٹیٹیوڈ ہے ٹورڈس فنکشنل پیشنٹس کے لیے. ہم ریئل چیزیں ڈھونڈتے رہتے ہیں. اس کا نتیجہ یہ نکلتا ہے کہ کاسٹ بڑھ جاتی ہے اور انوپریٹ کیئر کے جو ہے چانسز بڑھتے چلے جاتے ہیں. لیکن کیا سب ڈوم اینڈ گلوم ہے یا کچھ اچھی چیزیں بھی آ رہی ہیں؟ کچھ اچھی چیزیں بھی آ رہی ہیں اور جیسا کہ میں نے عرض کیا کہ این ایم سی میں خاصی اس پہ جو کیا جاتا ہے کہ فنکشنل ڈسارڈرز کے بارے میں بھی اسی طرح ایجوکیٹ کیا جائے. اور ریسنٹلی بہت زیادہ اس کے بارے میں کچھ عرصے سے ریسرچز اور سب کچھ چل رہے ہیں دنیا بھر میں. اور جو فاسٹ لائف ہونے کے باوجود جو لائف فاسٹ ہے وہ بھی اتنی سلو ہے جو کوپ کرنا اور آرٹیکلس میں اپ ٹو ڈیٹ رہنا ایون جسٹ دس ون سنگل ٹاپک آف آئیڈیاز از ناٹ ویری ایزی. کلینکل ایویلیوشن کیسے کرتے ہیں؟ 4 مین چیزیں. سب سے زیادہ امپورٹنٹ میری نظر میں کلینکل ہسٹری. کیئرفلی ٹیکنگ کلینکل ہسٹری از ویری امپورٹنٹ ان ڈائگنوسنگ اینڈ آلسو کمیونیکیشن with the patients are extremely important in managing this condition. Physical examination has some but limited role. Some investigations need to be done, including some GI luminal investigations, but you don't need to dwell into too many investigations in doing the diagnosis of IBS. ٹریٹمنٹ آف آئی بی ایس ایسا نہیں ہے کہ آج ہم اس پہ بہت زیادہ بات کریں، لہٰذا ابھی ہم انشاءاللہ تیزی سے آگے چلتے جائیں گے، انشاءاللہ پھر کسی موقع پر ٹریٹمنٹ کے بارے میں زیادہ بات کریں گے. لیکن کوئکلی confident diagnosis is extremely important. When if you are not sure yourself about the diagnosis, it's very difficult to convey to the patient what's going on. Explanation of the symptoms is extremely important in the management of IBS. Cope कैसे करें in symptoms से, healthy lifestyle is very important to educate the patients. ری ایشورنس بہت امپورٹنٹ ہے. بہت سے لوگوں کے ذہن میں جو آئی بی ایس کے سفررز ہوتے ہیں یہ خیال ہوتا ہے کہ ان کو کوئی بہت سیریس قسم کی ڈیزیز ہے انکلوڈنگ کینسرس. تو ری ایشورنس بہت امپورٹنٹ ہے. اور ایک تھراپیوٹک ریلیشن شپ، ڈاکٹر پیشنٹ ریلیشن شپ ڈیولپ ہونا، کیونکہ اٹس اے لانگ ٹرم پرابلم، لہٰذا یہ بہت زیادہ امپورٹنٹ رکھتا ہے. ڈرگ مینجمنٹ ہے جو کہ سمپٹومیٹک ٹریٹمنٹ اپروچ ہے. ڈائٹری مینجمنٹ ہے. سائیکالوجیکل ٹریٹمنٹ ہے انکلوڈنگ سی بی ٹی اینڈ گٹ ڈائریکٹڈ تھراپی. لو فوڈمیپ ڈائٹ از ویری انٹرسٹنگ اینڈ ویری امپورٹنٹ ون. کبھی کبھی میں محسوس کرتا ہوں کہ جو فیس ٹو فیس انٹریکشن ہے اسٹوڈنٹس کے ساتھ اور دوستوں کے ساتھ یا جن کے ساتھ بات کی جا رہی ہے از ویری ویری امپورٹنٹ. کیونکہ میرا خاص طور پہ جیسے یہ سلائڈ دیکھ رہے ہیں کافی دل چاہ رہا تھا کہ پوچھتا کہ کتنے لوگ ہیں جن کا خیال ہے کہ یہ بات صحیح ہے، کہ یہ واقعی ابراہم لنکن کا ہی کوٹ ہے کہ ڈونٹ بلیو ایوری تھنگ دیٹ یو ریڈ آن انٹرنیٹ. Of course it's not right because there was no internet in the times of Abraham Lincoln. Similarly for COVID-19, don't believe everything that you may read on internet and social media. Challenges in the management of or diagnosis of IBS. European expert panel تھا جس نے کہا کہ پرابلم یہ ہے کہ سمپل ڈائگنوسٹک ٹیسٹ اویلیبل نہیں ہے ٹو ڈائگنوز IBS. کمپلیکس اپروچ ہے فار دا مینجمنٹ اور سکسیزفل مینجمنٹ. But that depends on how confidently you have diagnosed positively and are you able to explain the underlying causes in relatable terms for the patients. ایک جیسا کہ میں نے کہا فزیشین پیشنٹ ریلیشن شپ ڈیولپ ہونے کے لیے چیزیں بہت ساری ضروری ہیں تاکہ ان میں کانفیڈنس پیدا ہو. اور پھر پاکستانی سوسائٹی کے اپنے ایک ایشوز ہیں جو ہمیں فنکشنل ڈس آرڈرس کو مینجمنٹ کرنے میں آڑے آتے ہیں، جیسے کہ فزیشنس کی ٹریننگ اور کمیونیکیشن اسکلز، ٹرسٹ ان دا پیشنٹس ڈیولپ ہونا، یہ کافی ضروری ہے. پیشنٹ ایجوکیشن، یہ کس بلا کا نام ہے اور کیا ہمارے پاس اس کے لیے ٹائم ہے؟ ہم پیشنٹ کے ساتھ بات کرتے رہے. یہ ایک ایشو سامنے آتا ہے. ہمارا ہیلتھ سسٹم بروکن ہے. پیشنٹ شاپ اراؤنڈ کرتے ہیں، فرسٹ اوپینین، سیکنڈ اوپینین، تھرڈ اوپینین، فورتھ، اب خدا جانے کتنے اور اوپینین، جس کا نتیجہ یہ ہے کہ کنٹینیوٹی آف کیئر نہیں ہوتی، کنسسٹنسی نہیں ہوتی، ریسورسز شارٹ پڑ جاتے ہیں. ڈائگنوسٹک ٹیسٹ کرنے کی ویسے بھی اتنی زیادہ ضرورت نہیں ہے، لیکن ہم ان کے پیچھے جب جاتے ہیں تو کیا ہمارے پاس اتنے ریسورسز ہیں، کیا ہمارے پاس اتنے کوالیفائڈ اور اچھے ڈائٹیشنس اور نیوٹریشنسٹ ہیں جو کہ ہمیں اس کی مینجمنٹ میں ہیلپ کریں. اور سائیکالوجسٹ اگر آپ کے پاس ہوں بھی تو اس کو کنوے کرنا پیشنٹس کو کہ آپ کو سائیکالوجسٹ کی ضرورت ہے. ریئلی آپ کا خیال ہے کہ میں پاگل ہوں، آپ کو میں بتا رہا ہوں جو مجھے پرابلم ہے تو آپ مجھے سمجھتے ہیں کہ میرا دماغ خراب ہے. کرپشن انفارچونیٹلی پاکستان کے دوسرے معاملات کی طرح یہاں پہ بھی ایک ایشو ہے. غالباً ٹائم کتنا رہ گیا؟ غالباً 5 منٹ رہ گئے, which is more than enough I think to go to the main topic, which is question number 1. Are patients with IBS more at risk of infection with COVID-19? کورونا وائرس ایشو ابھی بھی بہت نیا ہے, اگرچہ 6-7 مہینے ہو چکے ہیں, لیکن it's nothing in terms of time that you normally require to understand and develop strategies to deal with the disease. ریسرچ ابھی بھی بہت ساری ہو رہی ہیں لیکن پھر بھی بہت لمیٹڈ ہیں. گائیڈنس فار ایوری سنگل ہیلتھ کنڈیشن از اسٹل ناٹ اویلیبل. It's however it is unlikely that IBS patients are more at risk of coronavirus, کیونکہ IBS ڈائریکٹلی امیون سسٹم کو سپریس نہیں کرتی. کچھ لوگ جن کو IBS ہوتا ہے ان کا امیون سسٹم ویک ضرور ہوتا ہے, جس کی ایک تو خاص بڑی وجہ ہمارے یہاں کا جو معاشرہ پرہیز کے پیچھے پڑا رہتا ہے کہ یہ نہ کھاؤ اور وہ نہ کھاؤ, اس کا نتیجہ یہ ہے کہ غذائیت کم ہوتی ہے اور قوت مدافعتی امیونٹی لوگوں کی اکثر کم ہو جاتی ہے. لیکن پھر ایک سوال یہ سامنے آتا ہے کہ کیا انگزائٹی اور اسٹریس جو کہ کورونا وائرس کی وجہ سے آج کل چل رہا ہے اس سے IBS کے سمپٹمز بڑھ جاتے ہیں, مثلا سوشل ڈسٹینسنگ, لاک ڈاؤن, فائنینسز کو کیا ہوگا لاک ڈاؤن کی وجہ سے, ہمارے فیملی ممبرس کا کیا ہوگا جن کو ہم سے خطرہ ہے یا ہمیں ان سے خطرہ ہے. تو ڈسرپشن جو ہماری ڈیلی روٹین اور ڈائٹ کی جو ہو جاتی ہے. تو کیا انگزائٹی اور اسٹریس آئی بی ایس کے سمٹمس کو خراب کر سکتے ہیں؟ ہمیں پتہ ہے کہ کچھ چیزیں ایسی ہیں جو آئی بی ایس کے سمٹمس کو ورس کر سکتی ہیں، جیسے کہ کچھ کھانے کی چیزیں ہیں، کچھ ایموشنل اسٹریس ہیں. لہٰذا کچھ لوگوں کو آئی بی ایس کے سمٹمس ورس ہو جاتے ہیں، مثلا ایبڈومینل پین، باؤل ہیبٹ آف بلوٹنگ، اور تھوڑی دیر پہلے جو ہم نے دیکھا تھا کہ یہی وہ سمٹمس ہیں، اور یہ ان میں سے کچھ سمٹمس ہیں جو کہ کووڈ-19 کے پیشنٹس کو ہو سکتے ہیں. لیکن جو کچھ عرصے میں پچھلے کچھ عرصے میں ہم نے بھی دیکھا ہے، many are seeing actually reduction in their IBS symptoms. ایک تو وجہ یہ ہو سکتی ہے کہ پیپل آر ورکنگ فرام ہوم. پلیز ڈونٹ گیٹ کنفیوزڈ، اٹس فرام ہوم ناٹ ورکنگ ایٹ ہوم. جو لوگ شادی شدہ ہیں اور اس فرق کو زیادہ اچھی طرح جانتے ہیں وہ میری بات کو سمجھ گئے ہوں گے. لیکن بہرحال ورکنگ فرام ہوم کین بی ریلیکسنگ. So less commuting stress and more relaxed schedule. We get time to spend with the families with the lockdowns, ability to do other things that we always thought we will do but we did not have time to do them. کس طرح آئی بی ایس کے لوگ پیشنٹس جو ہیں وہ سیف رہ سکتے ہیں؟ ریگولر ہینڈ واشنگ، اوائڈ ٹچنگ دا فیس، ریگولر ڈس انفیکشنس جو کہ سب سنتے آ رہے ہیں. کون سے سمٹمس ہیں جن کے بارے میں یو شوڈ لک آؤٹ فار؟ Obviously that we discussed earlier: diarrhea, vomiting, abdominal pains, loss of taste and smell, skin rashes. اور یہی ان میں سے کچھ سمٹم وہ ہیں جو آئی بی ایس والے پیشنٹس کو ہوتے ہیں. لہٰذا جانتے ہیں لوگ کہ ان کو کون سے سمٹمز ہو رہے ہیں، لہٰذا ان کو پہلے سے پتہ ہوتا ہے کہ ان کی آئی بی ایس سمٹمز ہیں، تو ان کو ان یوزول سمٹمز کو خیال رکھنا چاہیے کہ واش آؤٹ کریں.
چار ہی بن جائیں گے.
It's a better speaker than me, I think, whoever is there, but I'll try and continue anyway. Self-management is a cornerstone of management of IBS. Take time for yourself, mindfulness, regular exercises, including yoga. There's a reason I'm mentioning yoga here, but I'm not going to tell you what it is. Ensuring a good intake of fruits, vegetables, and water, and lots of others. ہم کیا اپنی امیون سسٹم کو بہتر بنا سکتے ہیں؟ ہاں بھی اور نہیں بھی، اس کا کوئی ایک جواب نہیں ہے، لیکن ایک امپورٹنٹ بات یہ ہے کہ جو بہت بلا وجہ کے جو پرہیز ہیں ان سے اپنا امیون سسٹم کو ویک نہ کریں. ہم اپنی امیونٹی کو بہتر کر سکتے ہیں، بہت ساری چیزیں جو لی جا سکتی ہیں، لیکن سب سے جو باٹم لائن ہے وہ یہی ہے کہ بیلنسڈ ڈائٹ از ویری ویری امپورٹنٹ ٹو امپروو یور امیونٹی. اسی طرح ایکسرسائز، مینٹل ویل بینگ، سلیپ، ریڈیوس انگزائٹی. یہ جو نمبرز ہیں کہ آج کتنے لوگوں کو انفیکشن ہو گیا اور کتنے لوگ مر گئے، ڈونٹ ڈویل ٹو مچ انٹو دس. اوائڈ سوشل میڈیا اف یو کین. ایکسرسائز، یوگا، کنسسٹنسی. ریلائبل سورس آف انفارمیشن. بہت سارے ایکسپرٹس بن گئے ہیں کورونا وائرس میں. ٹرائی اینڈ اوائڈ دیم. اسٹک ٹو دا ریلائبل سورسز لائک WHO اینڈ NHS ایٹسیٹرا. کوشچن نمبر 2 کہ اگر آئی بی ایس والے پیشنٹ کو ہو ہی جائے کورونا تو ان کا آؤٹ کم کیا زیادہ سیریس ہوتا ہے؟ ون ورڈ آنسر: نو. سیم ایز ادروائز. اگر آپ کا امیون سسٹم ادروائز اچھا ہے، جنرل ہیلتھ ویسی اچھی ہے. So in conclusion or in summary, there is nothing to suggest that IBS patients are more at risk of developing coronavirus. General guidelines to ensure sleep, diet, mental health, and exercise can help the immune system. اور ایک دفعہ اگر کسی کو ہو ہی جائے کورونا IBS والے پیشنٹ کو, there is no higher risk of contracting, and also there is no more risk of a more serious outcome from it. ایک ہی مجھے اسٹوڈنٹ نظر تو نہیں آ رہا, لیکن میں تصور سے دیکھ رہا ہوں کہ جاگا ہوا یہ وہی اسٹوڈنٹ ہے یا وہی ڈاکٹر ہے جس کو IBS ہے. باقی سب آرام کے ساتھ سو رہے ہیں. تھینک یو ویری مچ.
Thank you very much, Professor Dr. Syed Zafar Abbas. Usually, it's a good, informative and interesting presentation you have given. You are not only a good hepatologist and gastroenterologist and a physician, but also a good teacher as well. Thank you very much. So our next speaker is Dr. Lubna Khemani. She is Associate Professor and Director of the GI Residency Program at Liaquat National Hospital. She's also consultant gastroenterologist at Aga Khan University Hospital, Karachi, and she will talk on COVID-19, pregnancy, and the inflammatory bowel disease. So I request her to please give her presentation. Dr. Lubna Kemani.
Assalamu alaikum everyone. I would like to express my gratitude to the entire team of Mohammed Medical College for arranging all these series of webinars during this pandemic, and special thanks to Dr. Abdul for inviting me for this talk. So my talk is IBD and pregnancy during COVID-19. Is it any different? So first of all, I would like to say that it is a challenging topic, because when three things are together, it is not a single disease, it's a syndrome. So over here, we are talking about syndrome, like we are talking about IBD, which itself is complicated, the pregnancy and the COVID. So how to go about? So the agenda of my talk will be the risk of COVID-19 in pregnancy, management of IBD in pregnancy, and some take-home messages. So first of all, the risk of COVID-19 in pregnancy. So pregnant women at higher risk of getting sick from respiratory virus because they are immunocompromised and they are adverse events for mother or baby. But there is no data showing that COVID affects pregnant women differently than others. There are specific case reports, case series, but no convincing data as yet. Clinical manifestations of COVID-19 in pregnant are similar to those in non-pregnant individuals. So the vertical transmission of COVID during pregnancy is less likely, although there are small number of babies who have tested positive for COVID shortly after birth, according to the published case reports. But we are not clear by now that if the baby got the virus before, during, or after birth. Infected pregnant women who develop pneumonia or got the virus in the late pregnancy are at increased risk of complications such as preterm birth and C-section. But again, we are not sure whether there is a direct relation with the virus and with these complications or not. So are IBD patients at higher risk of COVID-19? Elderly and patients with comorbidity, we all know, who have multiple comorbids, are at severe risk of infection. The risk of severe infection is slightly higher in patients with immunosuppression therapy or biological agents. And despite the potential risk of COVID exposure in IBD patients, the available data and expert opinion suggests that IBD patients do not have greater risk of COVID than the general population. So the course of IBD during pregnancy is determined by the disease activity at the time of conception. This is important. Those patients who are remission at the time of conception, it has seen that they remain in remission during pregnancy, because we all know that pregnancy is an immunocompromised condition, so the disease does not become active, or there are less flare as compared to regular days. 70% of the patients with active disease at conception continue or worsen the symptoms during pregnancy. So women with IBD at increased risk of worsen pregnancy outcomes as compared to without IBD. So the result of American Gastroenterology Association International Consensus Meeting, the PSG, the IOIBD, which is International Association and International of IBD Management during COVID, they all consider three categories in the management of IBD and pregnancy during COVID-19. IBD patient who is not infected with COVID-19, remission and active. IBD patients with SARS-CoV-2 positive, but they are asymptomatic. And IBD patient with confirmed COVID-19 with or without active IBD or other GI symptoms. So management of IBD remission in pregnancy with no COVID-19. In this, what you need to do, you have to follow these patients throughout pregnancy. That is important. IBD monitoring is important, especially in first and second trimester. And you need to repeat frequent blood tests like CBC, LFTs, albumin in these patients. Maternal and fetal monitoring is very important. So routine antenatal care is important by the gynecologist. Fetal growth ultrasound on third trimester is important. whereas the fetus is short for gestational age, or if there are any problems with the amniotic fluid. Examine the perineum for evidence of active disease and counsel on the mode of delivery, especially if they have active perianal disease or fistulas. So the management of IBD remission in pregnancy with no COVID, the general recommendation is to stay at home and on same therapy, and encourage adherence strict social distancing so that they don't contract COVID-19. Work from home as much as possible, and meticulous hand hygiene. So these are regular things which we all need to practice, so nothing special. Continue with biological therapy throughout pregnancy without interruption. So this is important in those patients who does not have COVID-19. No increased risk of complication after 24 weeks. But please do not stop therapy at 24 weeks, because there is risk of relapse after 24 weeks if you stop therapy. Elective switching to injectable therapy is not recommended associated with relapse. Switching to home infusion is not recommended. I think there is some disturbance at the background. Okay. Switching to home infusion is not recommended. Risk of infected nurse from traveling between homes. So if you call nurse from outside, if somebody is coming from outside, there's a risk that they might give you COVID, because pregnant patients are already immunocompromised. And there is no risk of infection to infant to 1 year. So IBD is active without COVID. You have to confirm the inflammation by non-endoscopic approach first of all. Don't jump into endoscopy. They are non-invasive tests which will give you a fair idea of activity of the disease, such as high CRP levels and fecal calprotectin, which is available at our Khan, and we do it day in and day out to find out the activity of disease. You have to exclude enteric infection, such as C. diff and other GI pathogen. Endoscopy only for emergent situation when you are expecting a severe flare, or you need to exclude CMV. That can be a game changer because the management is totally different. Knee GI follow-up every 2 weeks. Virtual or online is advised as compared to physical. Adjust the medications accordingly, according to the activity, and of course monitor drug level and thiopurine metabolite. I'm not sure whether any lab is doing it, and fecal calprotectin. So maternal and fetal monitoring is the key. You have to do fetal growth surveillance for every 4 weeks. So basically these are done by the gynecologist. And NST-BP as usual, these are basically to see whether the scans, whether the baby is active, there is to see whether there is a proper movement of the baby, the heart rate, the tone, everything will tell you with this scan. Antepartum surveillance, and then we have to see the cervical length. That's screening at gestational age of 18 to 22 weeks. If the length is 25 millimeter, needs regular follow-up. Then there's nutritional support is very important, because IBD patients are generally have low albumin. They are probably malnourished, and in Pakistan the females are already malnourished to start with their pregnancy, and together with this they have pregnancy. So nutritional support is the key, because now we know that any disease outcome in any disease is based on nutritional support. So if the patient is on steroid, need to screen the blood sugar levels to find out gestational diabetes, counsel the mode of delivery. C-section for patients with, if there is active fistula or active perianal disease. Otherwise, you can offer these patients trial of vaginal delivery, which is the first choice. So then we have to see if the patient has COVID. If it's mild, you consider topical therapies, oral budesonide, and symptomatic therapy. But if it's moderate to severe flare, treat as you would normally. Avoid hospitalization, complication, and because you don't want a patient to get admitted, because then their chances of getting COVID will become high. Consider avoiding thiopurine as much as possible, methotrexate and tofacitinib, because it reduces the CD4 T cell count, which delays the viral clearance. But if it's necessary, then you can use. If the patient has life-threatening complication or it's severe flare, then you can use. But please try to avoid as much as possible. Severe COVID is associated with cytokine release syndrome. Interleukin-1, interleukin-2 are high expressed in these patients, and the use of steroids is controversial. But now we can use steroids. There's ample data of dexamethasone, and we can use dexamethasone, and most of the bigger centers are now using dexamethasone. Some studies about interleukin-6 inhibitor have positive phase 2 data for Crohn's disease. And experts suggest to avoid steroids during COVID, but if needed, low dose of steroids should be started around 0.5 mg per kg for shorter duration of time, 7 days, and it may be beneficial in controlling overwhelming inflammation and cytokine-related lung injury. The AGA suggested to move the patient to lower dose of steroids, less than 20 milligram prednisolone, and transition to budesonide. So no data showing that immunosuppressive therapy increases the risk of complication or risk of poor prognosis. The balance between the risk of IBD flare and the course of the COVID needs to be decided. Low level of CD4 cell associated with longer virus clearance time, and that's why we need to avoid these immunomodulating agents as much as possible, like JAK inhibitor. And you need to hold it for 7 to 14 days after clinical recovery. And delay the dose of anti-TNF and other monoclonal antibodies for 2 weeks while monitoring the development of COVID symptoms. So when there is active COVID-19 with or without IBD flare, this is the most challenging category, because most of the drugs which are used in IBD are contraindicated or have relative contraindication in COVID patients. And according to, again, disease severity of COVID infection, whether the COVID infection is mild, moderate, or severe, we need to give these patients the medications of IBD. So if there is mild COVID infection, that means the patient is not hospitalized or the oxygen saturations are more than 94%, and there is no evidence of pneumonia. Taper the oral steroids to 20 milligram or switch to budesonide. But sometimes budesonide is not widely available, especially in rural areas or especially in smaller towns. So they have to rely on steroids, oral steroids. Continue 5-ASA, budesonide, rectal therapy, and enteral nutrition. Hold thiopurine, methotrexate, and tofacitinib. Delay biological agents for 2 weeks and see if COVID resolved or if there is antibody titers of COVID has developed. And if not, continue holding the biological agents. For moderate to severe COVID, which means that patient is hypoxic, is hospitalized, there's radiological evidence of pneumonia, there's severe COVID infection, patients are requiring pressors, they are on mechanical ventilation with evidence of an organ damage. Treatment consideration for COVID-19, taper steroids, switch to budesonide, continue 5-ASA, budesonide, rectal therapy, enteral nutrition, hold thiopurine, methotrexate, tofacitinib, delay biological agents again till it becomes the COVID symptoms get resolved. Focus on life support and treat COVID because this is more life-threatening emergency rather than the IBD. We need to give them anti-inflammatory, antiviral, and dexamethasone. So when do you restart IBD meds after COVID infection? Basically, there aren't much data because there aren't much clinical trials on pregnancy. And all these consensus are based on expert opinion, basically. So IBD meds can be restarted after 14 days, provided they do not develop COVID symptoms or after COVID symptoms are completely resolved, or at least 2 nasopharyngeal PCR tests are negative, because there's a false negativity rate of 30%. So out of 3, you get positivity of 2 and 1 is false negative. So you need to make sure before starting biological agents that the 2 nasopharyngeal PCRs are negative. That is important. So the conclusion and take-home message, IBD without COVID should not discontinue the IBD therapies and should continue scheduled infusion at appropriate infusion centers. IBD with COVID positive but asymptomatic should hold thiopurine, other immunomodulating agents, and dosing of biological therapy should delay weeks while monitoring for symptoms of COVID-19. IBD with active COVID should hold all immunomodulating agents during viral illness, and you need to document 2 negative nasopharyngeal swab before starting this patient on infusion therapies with monoclonal antibody. The severity of the COVID and the severity of IBD should, there should be careful risk-benefit assessment, and regarding treatments for COVID-19, escalating treatments for IBD. Pregnant women should not be different from others. No increase in risk of COVID, no increased risk in birth defects, no increase at the risk of infection in newborn. Thank you.
Thank you very much, Dr. Lubna. It was a nice and interesting and informative presentation covering all the covering the topic with all the systems as well. Now I have 1 or 2 questions to be asked by the audience. The first question is from Dr. Syed Zafar Abbas, that are there some natural treatment for irritable bowel syndrome or the inflammatory bowel disease?
Yes, there are several, and they have been advocated by lots of people in lots of areas. Unfortunately, none of them is of any proven benefit. There are lots of anecdotes. So one of the things that does sound or does show some improvement is peppermint oil. So peppermint tablets or capsules can be used for the bloated sensation, and they seem to work. All the other medications that have been tried a lot, they have not either proved to be useful in treating IBS, or have sometimes backfired and caused some other symptoms such as heartburn and all that. So no, there's no definite proven benefit of any natural or herbal remedy in IBS.
Thank you very much, Dr. Zafar. And I think the females are looking or seeing this program more. So I have 3 questions with Dr. Lubna. First is that can COVID be transferred to the child during pregnancy?
We are not sure. There are some case reports that newborns were positive, just I've mentioned in my presentation. But we are not sure whether they were infected during delivery or in the newborn period or vertical transmission. So the things are not clear because we don't have any trials on this. But yes, there are some case reports, case series of COVID-19 being present in newborn.
And the next one is that there is treatment of COVID in the newborns.
I'm not sure because there is no treatment for COVID up till now. We are still looking for the medication. So it's just a symptomatic care. And for severe, you give dexamethasone, anti-inflammatory, and all supportive measures. So for newborn also, you can give that, I guess. Why not?
Achha. And the next one is that drugs more suitable for the inflammatory bowel disease during pregnancy.
We can give all. As I've already mentioned this, we can give steroids, we can give topical, we can give biological agents, the infusion, everything. So if the patient does not have COVID and patient has IBD, it's normal basically. All the immunomodulators can be given depending upon the severity of IBD.
Whether the first trimester or the second trimester or the third trimester?
Yes. Because the issue is we need to control IBD. The outcome depends upon the activity of the IBD. So we need to control the IBD. That is the first point. So whatever medication is required, and you have to go stepwise fashion. So before even pregnancy, you ask those ladies to if they should be remission for at least 6 months, then only it's important that they conceive basically. So the remission is important rather than medication. So you need to keep them in remission, and the outcome directly depends upon the remission.
Okay, thank you very much, Dr. Lubna. And we have Professor Dr. Wasim Jafri Saab to be here with us. And I request him to please give your comments. He need not any introduction. So I request him to please give a few comments on this presentations and program.
Thanks ever so much. I have really enjoyed listening to Zafar and Lubna. And, this is really congratulations to Professor Abdul Qadir for taking this very important initiative, because there has been a series of, these webinars going on. And I guess, physicians at large, especially in the periphery around your hospital and all that, if they could just log in. And I'm sort of somewhat disappointed when I see that participant list is only 11. I would have thought that this is particularly meant for all those people around the vicinity of Muhammad Medical College and, the interior of Sindh and all that. So maybe the figure is more than that, but on the screen it shows participants 7, so that should be different. Anyway, dealing with the COVID pandemic, we should never ever forget that the existing diseases are there and they need to be monitored, they need to be looked at, they need to be diagnosed, and of course effective treatment has to be given. Irritable bowel syndrome, of course, is one such entity that if we don't have it right now, we are not humans. As simple as that. So, we are emotionally upset. We are upset because what's happening around us with some of our friends, relatives, or community at large is suffering hugely. So emotions bring in stress, and that's how the irritable bowel syndrome is triggered. People who never had irritable bowel syndrome are having it. The presidents and the prime ministers and the ministers and whatnot, because they are having nightmares because of COVID right now. And, they are having all kinds of symptoms. And if they don't, they are not made of wood and furniture. They should show that anxiety and stress and all that bit. And the management is very simple, as Professor Zafar has very nicely outlined, that look into, in fact, those healthy aspects of life, try to allay stress as much as you can. I think it is state of the art. How you do that is individual. Collectively, one can easily say it on a screen that, all right, take care of your stress. But the person who is dealing with all kinds of things has got his own, reasons to be under stress and whatnot. Lubna has covered it magnificently. I mean, I'm always fond of her talks, and she has just elaborated at length about IBD for anybody. You may be an expert, or you may be just beginning your career about it, and she summarized it wonderfully well. All aspects of IBD, with or without COVID. So without COVID is existing, it is there. And with COVID, of course, we do not have enormous data. The questions about biosimilars, we don't know, because the data, the clinical trials, where are they going to happen? Patients are critical, patient in ICU, patient whatever. But yes, patient, if he has or she has got a very active, IBD, where I need to really address the issue, then I would take care of that, in fact, with all the means that I have. I may not have the safest medications, but under circumstances, one takes care of all those things with expertise that one may have. One very important thing is that these patients are managed everywhere. People have put up tents and made some emergency hospitals and whatnot. So those places should have that kind of facility where a specialist cover is available whenever that is needed, and that really is the situation in developing world and in Pakistan and India and all those countries. But patients of IBD exist, patients of irritable bowel syndrome exist, and all that bit. So this seminar really has dealt with entities. They are different, but IBD patient can have IBS. IBS patient can have IBD. So here you are. You don't. These are not mutually exclusive. Somebody who is very wonderfully controlled with IBD, seeing me in the clinic for the last few years, controlled on just simple Nasacol or Asacol or whatnot. She or he would come in with more frequency of stools and all that bit. And as has been said, that I need to exclude the infective component, the calprotectin and all that bit. And then, of course, manage this patient IBD with the IBS type of features. And same is the case, vice versa, the IBS with IBD or IBD with IBS. Thank you.
Thank you very much, Professor Dr. वसीम जाफरी, for your valuable comments. और वो कहते हैं कि आपने दरिया को कूजे में बंद कर दिया, तो आपने 2-4-5 मिनट में बहुत अच्छी valuable comments. Thank you very much. Thank you. अच्छा,
Thank you.
अच्छा, Doctor, the president of PMM Vipohas is very busy, so he doesn't join us. So on behalf of PMM Vipohas, I, as a ex general secretary and also a life member of the PMM Vipohas, I thank you very much for nice presentations on this COVID-19 and other problems. Dr. Sayyid Zafar Abbas, Dr. Lubna, Dr. Wasim Jafri, and now we have a concluding remarks from Dr. Professor Razi Saab, and also the GATS Pharma, who have really arranged these valuable and important and informative sessions on this problem. And some of his officials told me that the attendance is more than 100. So I think the number of attendance is increased. Now, I request Professor Dr. Sayyid Razi Muhammad, the Managing Trustee of Muhammad Foundation Trust, Professor of Surgery at Muhammad Medical College Hospital, Mirpukhas, for the concluding remark. Professor Dr. Sayyid Razi Muhammad.
Assalamu alaikum, everybody, and thank you for letting me speak on this great occasion. Today is the last day, as I understand, last day of the series of talks, and I'm grateful to all the speakers and congratulate especially my two professors, Professor Abdul Qadir and Professor Shamsul Arfin, for presenting it nicely. I totally agree with Professor Jafri on one thing, that he said that people around the area, not only of Mirpukhas, but perhaps entire part of the scenes outside Karachi, should be actually listening to it. And I take pride in the fact that Muhammad Medical College has actually been representing this population at various circles and putting forward the research, the various thoughts, the problems, the proposed solutions of the rural areas. And so on this regard also, I think that the speakers and the organizers, including the GATS Pharma, need to be congratulated, because a lot of things came forward. And that is again a very thing. As we are running one of the largest program of online education at Mirpukhas, which is with the name of Survive, I would ask Dr. Shams and Dr. Abdul Qadir to make this whole series a part of that program as well, because as you have seen that more than 500,000 submission of assignments has been done during this time by the students, and they have been checked, graded, and they have been remarked. And even the head of the Department of Medical Education of Dundee has congratulated the entire team for this online program. So I think if we make this program a part of it, that will also go a long way. Third thing is that what this seminar has done it. I'm not sure that Dr. Qadir intended that, but one of the things that it has done is it has opened a gate for the series of the seminar on Zoom that can be conducted by a platform like Muhammad Medical College. And I would request the other people to come forward, like and have the program. Like Dr. Zafar always does a week of gastroenterology at Mirpukhas. I think this program has covered it mostly, but surely other people can come forward, departments can come forward and arrange and do that. I'm sure that GATS Pharma and their other colleagues will be happy to participate in that too. The another thing is that I'm very grateful that you people made it very relevant. I mean, I have been attending lots of seminars and talks on COVID-19, which are purely so much scientific and were only targeting the people which are heavily specialized on one particular field. But today you heard two talks, and before that also, Dr. Lubna made it very, very easy for people like us who have nothing to do with gynae and obs to understand her talk. And Dr. Zafar not only covered the IBD, but he also covered the mentality, the social, the psychological problems. And he also discussed about the time, the physicians having time to talk to the people. Until we can address the human issue and make it relevant for the people who are our target audience, what's the point of having all these seminars? Just to tell them that how much I know? No, the point is to make them gain something out of your talk. And I congratulate both of the speakers today because they did it very nicely today. So I think that I don't have words to praise you people and your efforts and the work you have done. And I think probably, if I guess it rightly, it might have even surprised you. The success might have even surprised you. You were not expecting so much of the. Just now, I was looking at the WhatsApp groups of the college, and I was looking at the students sharing the talks to various groups that please join it. Such a nice talk is going on. Join the quickly on the Facebook, and obviously, when I was giving the talk on the other day, I found that there were 2,000 people in the Facebook actually which were there. So it's going a long way, and inshallah ta'ala it will be shared. And thank you very much for your everybody's participation, and for Dr. Abdul Qadir for arranging it, Dr. Shams for moderating it, and Gets Pharma and the speakers, and Dr. Wasim Jafri especially. He is always, as Shams put it rightly, that he is beyond any introduction. He is beyond any introduction. He's a legend, living legend. And thanks, Dr. Qadir, for bringing him on today. It was a long time, but nice listening to me again. Thank you very much.
Thank you very much, Professor Dr. Syed Razi Mohammad. And before I hand over to Dr. Qadir, one comment from my side that I am thankful to Dr. Abdul Qadir, Gates Pharma, and my IT team as well, Mr. Fetal, Abbas, and Mr. Zubair, who makes me more computerable now. I was not like a computerable person before, but they makes me, and using these technologies, Zooms and all these model. So I have learned a lot from these sessions as well. Or this last program, inshallah, we will have more. So I hand over to Dr. Abdul Qadir to summarize and end up the meeting. Thank you very much. Yes.
आवाज आ रही है आपको? So thank you very much, Dr. Shamsul Arfin. I'm very much thankful to my teacher, Professor Wasim Jafri, and it was his initiative and the man behind this this scientific program. It was not possible without the help of such a great teacher. He guided me and how to go forward, how to start the series. It was very difficult to start and to take initiative. Because we are living in the rural area where there are a lack of facilities. But I'm again so much thankful Dr. Syed Razi Mohammad who providing me this the platform, Muhammad Medical College. Thanks Dr. Syed Zafar Abbas, Dr. Luna Kamani, all the team, Gets Pharma, Fezan, and the Zuhaib, and all the persons who done a great job in this webinar. Inshallah, in future, with the help of Muhammad Medical College, Sir Wasim Jafri will do these types of the programs as well. So thank you very much, Dr. Lubna, Dr. Zafar, and all the team. Thank you very much.
Okay, Allah Hafiz. Thank you very much.
Thank you very much, and Allah Hafiz. Allah Hafiz.